Most obstetricians order at least 3 sonograms during a pregnancy. One at 12 weeks of pregnancy as you end the first 3 months, one halfway through the pregnancy, and one as you begin the last 3 months of the pregnancy at about 28 to 30 weeks of pregnancy. I would like to talk about specifically the halfway one, the 20-week pregnancy sonogram. There are many details in that sonogram. We talk about growth charts and we talk about the anatomy of the baby. But one important little detail on that report is the amount of amniotic fluid around the baby. And I want to pause there because it's such an important piece of information. You know what amniotic fluid is made out of? About 80% of it is fetal urine, 20% from the placenta. So many people are sort of alarmed when I tell them it's fetal urine, but pause and think about that for a second. If the radiologist is saying that the amount is normal around the baby and we know it's fetal urine, that means that the baby's kidneys are working normally. That means that the tube from the kidney to the bladder, the ureters, are carrying the urine down there, developed and working normally. That means the bladder has nerves in it that can sense when it's full, and then muscles that squirt it out working normally. That means that the sex organs on the baby are developed properly, letting the urine out, working normally. And then so it doesn't overfill inside of the woman's uterus, the baby swallows the amniotic fluid, which means the GI tract is all formed normally. There's no obstructions in the GI tract. There's muscles that move the fluid through the GI tract. There are nerves that go from the brain through the spine to the muscles to make the muscles move in sequence. That means the intestines can absorb the fluid, send it to the liver. The liver processes it, sends it back to the kidneys, and it starts over. And it also implies that there's an intact cardiovascular system, that all that has to be well vascularized to be able to do that. And errors can occur in any of those steps in any of those different organ systems. So when a radiologist tells us that the amniotic fluid is normal around the baby, that tells us that at least a dozen organ systems in that baby are working perfectly. Pretty amazing, huh?